have a background in quality improvement, so I'm trying to learn more about data analytics and quality improvement and how it relates to critical care. Tufts is always ranked very highly in the quality of care they give to patients, so that was one of the attractive things that brought me here.
It's one of the really big strengths of our program in pulmonary is pulmonary hypertension. Then you also get the palliative care aspect and having end-of-life discussions, and for whatever reason I've always been drawn to that. So I think that you see people at their their most critical illness, but then you also have these family discussions and you're able to kind of marry the science with humanity.
We overlap a lot with the cardiology service, and some of our attendings in pulmonary critical care actually also attend in the Cardiovascular Institute and work with some of those patients on minimally invasive circulatory support devices. We also go up to Lowell General Hospital, which is north of Boston. We run 2 separate ICUs up there that are very busy. Our fellows have really liked this experience primarily because it gives them autonomy and gives them a chance to practice more experiential learning in the course of their career.
In terms of the size of the hospital, it's relatively smaller, but at the same time, we do rotate at many different areas of our specialty. So, we get to not only experience our usual bread and butter of pulmonary critical care, we also have different specialized clinic at Tufts. We do clinics like sarcoid clinic, we do clinics like asthma clinic. We actually go to Rhode Island and we have a specialized ALS clinic there with Dr. Hill. And we see a huge patient population of PH, patient pulmonary hypertension. We get to go to Lowell and work in a community hospital. So I think what matters more is the diversity of experience that you get here more so than the size of the program, I think.